Midwife Sally, I'm pregnant and I feel so sad. I'm crying a whole lot. And so today I brought somebody who is specialized in mental health. She has been practicing for over 10 years. Yes, over 10 years with good experience. So she's going to tell us all about mental health during pregnancy, labor, and even after birth. She is in the person of Madam Agnes Otu. Madam Agnes Otu, welcome to today's program.
Thank you very much.
Okay, so she's a nurse at the Postpartum Polyclinic here in the Postpartum district. Welcome to the show.
Thank you very much.
Okay, so there is a lot we want to discuss about. In my introduction, I mentioned that we have a lot of mothers who are always asking about mental health. I didn't even know it was that serious until I became a midwife and Midwife Sally and all that. And I remember I've even referred the case to you before. You remember?
Yes, I do.
Okay, yeah. So we are going to delve into it, and we are going to start from the top to down. We want to get everything about mental health, and everybody who watches this video should be satisfied, have no questions and all that. So today, I think the first question we would ask is, what is mental health?
Oh, okay, thank you. When we say mental health, it is in two parts. When we say somebody is mentally healthy, we are saying that the individual is able to cope with stresses, everyday stresses, and then other challenges, no matter what the condition and then the time. It means that the person is mentally healthy. An example is when we say somebody is mentally healthy, like somebody who is not feeling well, and then he goes to the hospital to inquire what is wrong with me. And so the doctor will say, maybe you have hypertension. Okay, so what do I do in order to go on with my day-to-day activities? And so once you have been able to recognize that you are not well, and then you go to the hospital or the right source of information, what do you do next? Now you take the medication so that you will be able to go to work, do your day-to-day activities, and what is a part of you. This makes you mentally healthy.
That's great. So for the fact that the person is able to get some insight into what is wrong with with him or her, even shows that the person is mentally healthy. Okay, that's great.
Yes.
Okay, so the other side of it.
Now, let's talk about what is mentally challenged, or when we say somebody is not mentally well. It means that the person even don't recognize that he or she is sick. So if you don't recognize, how do you even go for treatment? There is no need for going for treatment. Even when you recognize that you are not well, you think that it's one of those things. So it means that you are not mentally healthy.
You know what you said has really set my mind to even not related to mental health, but maternal health. Because we have cases where the woman knows that she's bleeding, and she's been bleeding for 2-3 days. She's losing her water, and she is at home. It could be related to lack of information, but then something is happening, and the person is not seeking medical help. So in that case, do we say it is lack of information, or the person, sometimes we the midwives, we get surprised, we don't understand. Yes. Because the person, I don't know whether, because what you are saying is really making me to think. Because they see a situation and the person is not coming.
Bad, and you need to go to hospital.
And the person at home also, she's gasping.
Sometimes it's a worry, and then we say that the person is not mentally sound. Why am I saying that? You are bleeding, and you know that as human, blood is like what keeps us going, like a car without fuel. And so as you are bleeding, something might happen. And even being pregnant, bleeding is a serious issue in pregnancy. You can lose your baby and other things. So if you are bleeding and you say you will not go to hospital, it means that you are not sound. Maybe you are feared that when you walk...
Could it be lack of information? Maybe she doesn't know that bleeding during pregnancy is not, it's not like it's normal, it's a pass, or I'm losing water.
So,
or it's here and there. It could be both.
It can be the lack of information, or the information acquired wasn't at the right source. Sometimes our people will tell you, our mothers will say, oh, a bit dry, so you don't relax, and so it can also be. But as we continue, we'll be able to know whether it is lack of information or as a result of mental challenge or difficulties.
So I think the next thing I'll ask is that are there types of mental health conditions?
Yes, there are. As we have types of physical conditions, somebody can say that I have stomach ache, I have headache, my hand is paining me, or my eye. So as with our mind, we also have different types of conditions. But let me add up, as we were saying that when we say somebody is mentally healthy, I was saying that for the individual to be able to identify that there is a condition and then taking the necessary steps to know more and then to do whatever is expected of you, it makes you healthy. Some people will also say that, why am I healthy? Because I'm sick. I have hypertension. I use money to buy medications every day. I'm not healthy. You are healthy. Because we are saying that day-to-day activities brings a lot of challenges, and we should be able to cope with it. That makes us grow. We learn from challenges, we grow, and then whenever we meet, we are able to reflect on past experiences and then go over. But if you are not able, then it means that you didn't grow from your past experiences. You are not healthy. So someone will also say that, so this hypertension, I learned that it will kill me. Or especially the men, they are saying if you take a lot of medications, you'll be impotent, and so no. Sometimes it's some fear that they have, you see, and fear is anxiety. It can also lead to a lot of things. So this is telling us that if you are healthy, no matter what, there's a challenge, and you have to go through.
Thank you. So it's about the coping mechanism. If you're able to cope with daily activities, then you are mentally stable and sound. Yes. So as I mentioned, we have types, and then the types, it's from sleeping disorders, eating disorders, to depression, and then it goes on and on, even to schizophrenia and other things. They are bipolar now of late. We are hearing it in the news, bipolar. You see people all over. Recent story.
Yes. We come to say that it is as a result of mental illness. And so we have types of it. But it starts gradual, as I said. You not being able to cope, then the other types.
Okay, then it can graduate.
Yes, to the worst.
Okay. So when it comes to pregnancy, a lot of us, we just see pregnancy as, oh, I'm pregnant. And I should be able to go through the pregnancy no matter what. Like, pregnancy is a physical thing, a physiological process that every woman should go through. I want to ask, in pregnancy, are there mental health issues? Are there mental health issues when it comes to pregnancy itself?
Okay. Pregnancy itself comes with challenges and then stress. Some, when they are pregnant, in fact, right from day one, they will go through a lot of sicknesses, weaknesses, vomiting here and there, and so it becomes more stress to them. And then some too, nothing happens to them. They go up and down without any even feel of pregnancy. Sometimes they themselves forget that they are pregnant.
Yeah.
You see. But where it comes, there is other challenges. When I said the pregnancy comes with its own challenge. So there's the fact that you are not able to sleep well, or seeing the changes of your body, and then other stresses like marital stresses, financial stresses, then it makes the stress more, and so we are saying too much of everything is bad.
Okay,
then it can lead to mental illness. Or some might also have previous history of mental illness, not necessarily that they are diagnosed, but it was undiagnosed. They themselves were not aware that they have, and then the pregnancy stress add up, and then it comes.
So the point is that people can be pregnant and then have mental health issues because of the challenges they go through. Okay, so I think I have seen certain situations come to me where the woman, let's go with doing before pregnancy. mother predisposed to the fact that when she gets pregnant, she can have a mental health issue before pregnancy? Are there things or predisposing factors that the person is not pregnant yet, but what are the things that she herself will know that, okay, we talk about preconception care. So let's talk about preconception care when it comes to mental health. How do we prepare ourselves? Or
okay,
yes,
as I said, you see, when you plan of getting pregnant, there are certain activities that you need not to do, or even when you are doing it, you must stop. Or even that activity, whether you stop or not, it can predispose you. One is smoking or drug abuse. Let me say drug abuse. Being smoking, alcohol, and other types. We know that this have effects on the brain, and then it also affects the way we sleep, the way we eat, and so it can predispose you to mental illness. And then we have somebody who has gone through childhood abuse, maltreatments, sexual abuse, any other form of abuse. Those people grow naturally to be depressed. They don't have love, they don't have trust, they don't even have attachment. And so this person is also prone. And as I said, it runs in the family. We have some families that have the condition. And so if the individual is in this form or category, during pregnancy stress, it adds up and then it can predispose.
Okay. So for such a person, she has all this condition, but she will want to be pregnant. So in that time when she's not pregnant, like I'm not pregnant, but I've experienced child abuse, I've experienced all that, what can I do? What preparation can I do so that I will not see myself getting pregnant and having all the mental health issues?
Okay, so as I said, for somebody to be, or for us to say that somebody is having mental issues, it must affect your day-to-day activity. And so let's say that you have been abused, or alcohol and other things. It makes you not to be able to take good care of yourself. And so your personal hygiene is neglected. And then if you have work, you are not able to go to work. If you are selling, it affects your occupational function. And then your social, with the way you interact with people. We say some people are quarrelsome, and so nobody wants to relate with you. When you see that you are experiencing this alone must tell you that if you don't work on it, it can what? Predispose you to mental illness. And so when you have one, you are not able to sleep well as a result of all these things. Two, your eating habits can also change, and even the personal hygiene, as I said, and then your occupational function. And then when all these things happens for 2 weeks or more, the duration also counts. Once in a while, we might have issues in life, like a loss of a dear one, 2 weeks or few days, we get over it. But some, even 1 month, 2 months, it means that that individual needs help. And so you can go for counseling, you can just walk into any hospital.
So there's counseling for such cases?
Yes, okay. It is. When you come, we assess to find out the level of the stress, and then if you need counseling alone, we do.
But I think some of you should also be obvious, because some of these cases, you realize that in our system, a lot of people don't know where to go for help. Because the person is depressed, and because you're a midwife, she'll come to you. And the husband is giving her problems. Because you're a midwife, she'll come to you. Any other financial problem, she'll come to you. But I think that just like a midwife is trying to be out there, a lot of women don't know where to go when they are facing psychiatric problems, mental health problems. And they don't even, the truth is that for the mothers I have worked with, a lot of them don't want to even walk to a mental health facility.
Yeah, because of the stigma.
Yeah, so I think that I would encourage people to be a bit more, seen, be more visible. Because I think if we have a midwife, a mental health nurse or a mental health doctor who is also a bit more visible, some of these cases, we have even about 10 spread across the country, and these women know that, if I call Nurse Agnes about my mental health issue, I'm preparing to be pregnant, and I feel, I'm even scared about the whole pregnancy idea because of my previous experiences. The person can speak to you, and the person will get counseling. Because I don't know, are people able to walk into your facilities like across the country to?
Yes, now we have something we call community mental health.
Community, okay.
Yes, so we are in the various health facilities. You can walk in there and then assess. You can go to the CHIP compound, the hospitals, the polyclinics. We are all over. And then we also go rounds in schools and other places, churches, to also advertise ourselves that we are there. But you see, because of the stigma, for somebody to walk out and say that I have mental health issue, that is it. And so now we are saying that even if you are not able to sleep, it's a sign. Come to the hospital and say that I'm not able to sleep. And we'll be able to help you. Or you see that your eating habit has changed. Now you eat more, or you don't even want to eat at all, but because people want to starve and die. And then when you also think that certain things, even at my facility like this, people with hypertension, high BP, and then even medications and other therapies are not helping it to go down. They come to us, and then when we probe further, you realize that there are issues. That is what's even causing that high BP. And so we are all over, but just that we are doing more.
Okay, so yeah, all over. I think, as I said, now online is to some extent taking over. So I'll still encourage all mental health nurses, doctors, create online spaces. People can come to your inbox, people can come to your website, and people can, so that it becomes more accessible. Because a lot of people are looking for help, mental health issues, and they go to the wrong people.
Yes, a lot. Recently, even with the COVID era, you see, mental health was something that wasn't, people didn't see the importance of it. But now COVID has also let us know that there is a need for us to take care of our mental health. And then thanks to social media, we have seen a lot of things going on, and then people are beginning to now
create awareness.
Yes, create awareness and then concern about our mental health. And so we are also there. We are at your services. Any time that you call us, we are there.
Okay, so for those listening, they can, when they have mental health issues, they can walk to every facility that is close.
Yes.
It's like the government ones, and they have mental health.
Not only the government,
the private,
the private hospitals too, because we go there to give help. We advertise ourselves there, and then we tell them where they can locate us if we are not even at that facility. And so the private or the government sector, you can walk in there and say, I'm not able to sleep.
It's much needed, much needed. I wish you were in my inbox to see all that I'm talking about. There are a lot of people with mental health issues, financial issues, too many. But because you're a midwife, you know we are the center. So we get all this. This program is sponsored by Sally's Pregnancy Class and Sally's Test for Expectant Moms. So if you want one, you can call us and then we will deliver. We also have an ebook. Welcome back. Okay, so as we were discussing, we're talking about somebody who is preparing to get pregnant. Yeah, so in conclusion, what would you say about that?
And so we were saying that if you see any change that is unusual, more especially in your personal hygiene, when I say personal hygiene, the way you take care of yourself, the way you take care of your home, your sleeping pattern, you are not able to sleep well, you are not able to eat well, or you eat too much, or you sleep too much. So it's either less or more. And then your occupational function.
You're not able to work properly at work.
Yes, at work, and then you are complaining about it. Sometimes you don't see yourself. People closer to you will say, these days you've changed. Or every day you complain of tiredness. Or these days you come to work late. When you come, you are yawning. You are complaining of headaches. Or always tired. You see, you have to get help. There is something wrong. It is not that you are mentally sick. No, there is a problem that needs to be solved before it leads to the other.
Most of the things you said even look like our daily activities, because I've seen a lot of people approach me, and it's like some of these things that they say, they make it look as if to even think they are pregnant, especially those who want to get pregnant, and they are like, she's anxious to get pregnant, and she's having all these symptoms you are talking about, and so she's thinking that it could be pregnancy, but it could also be a mental health issue.
Yes, you see,
Wow.
that's what stress can do.
Okay.
All these things boils down to stress. When you are stressed out, the stress hormones that are released, that leads to all the headaches, the pains, and you see somebody who is looking for pregnancy for quite a long time. There's so much anxiety, expectations from even the community, your family, both sides, the church. In fact, the stress is not easy. And so if that person doesn't take time or need good counseling, it will trigger mental illness in no time. And these people, when they get pregnant, they need special attention. Special one. Thank you. And these are the people that can get mental illness fast because their cases are already, they are having the depression already before even the pregnancy came.
Okay. Yeah, so if you are listening and you have seen you can't sleep, you cannot eat well, you are eating too much, you are eating less, you can't work properly at work, and you are planning
for 2 weeks,
persistent for 2 weeks or
more,
2 weeks or more, you can seek help from a mental health unit. As you said, you can walk into any facility and they'll be there to help you. So we are going on. During pregnancy itself, I've had mothers call me and what they say is, okay, so I'm pregnant, my husband is there. It's not like I have a need, my husband is there and everything, but the person makes it like I try to ask them on phone to find out what is happening, and they try to make it look like everything is okay. But she says she's just crying. She's just crying. So
what's my opinion?
What can be the cause and why? Why is it so?
You see, pregnancy is something that brings joy and excitement to people, but not all the time. Especially with the time of pregnancy. Let's say the individual is not planning now to get pregnant, but it has come. That one is one factor. Or the pregnancy has come, but the expectations or what she's expecting to do. Some people are like concerned about their shape. Now I'm pregnant. I'm the type who have all the shape. Back as is and then the front. You see, now pregnancy is going to disfigure me. So it brings worries. And some also have the expectations like when I'm pregnant, I should be able to walk this way. I should be able to get this type of dresses or this type of treatments, and those treatments are not coming. They also have seen on social media and other places how pregnant people look like they are still like okay, but with me, my face is swollen, there are changes, I'm not able to eat. What type of issue is this? And so although all other things are there, it doesn't give them joy. Then you see them crying small. Or, as I said, it also comes with its own stress. Some people are pregnant, but they have this morning sickness, vomiting, weak all the time. And then if you are the type who is always up and down, or the nature of your work doesn't allow you to be in the house or to be lying down one place, it brings a lot of fear. And then, so is it going to continue? If I be in the house, who is going to take care of my work? Okay. Or now that my shape is not like the first, would my husband pass somewhere? Or, you see, all these things are fear. And then high expectations, that leads to people with
having mental health.
Or we start from sadness. They start becoming sad of this issue. Then, as I said, more than 2 weeks, and then it leads to the mental health issues.
It's really interesting. Do hormones also play a factor because they're pregnant? Could it also be there be a little link between?
Yes, there is. You see, as I said, pregnancy is stressful for some people, and so once stress comes in here, there are stress hormones. So when it happens that way, and then you don't get support. The stress hormones need support. Somebody that will encourage you, that will make you happy. Even when people are so sad and they have the strong support, you see that it doesn't affect them much. And so when you don't need the support, then the pregnancy stress plus lack of support together can also
So
affect.
it means, okay, so from what you are saying, it looks like, let's say, partner support or the community around you should be able to support you as a pregnant woman for you to be very stable.
Yes,
Is that what you are
more
saying?
especially the people who are pregnant for the first time. What do you call it? The
Primates.
yeah, the primates. You see, they've heard that when you are pregnant, the only thing they know is to take photo shoots, to show their tummy, but they don't know what it entails.
Like it looks so nice.
Yes, it looks so nice.
Now everybody is doing it.
Yes, but they
really
don't know that
beautiful.
you wouldn't be able to sleep, you wouldn't be able to go. So when they start that and then they don't get the support needed, that is where their expectations were not met. And then
so during pregnancy, what are some of the things the mothers can do to reduce all these things? Like, I think you've talked about support. I think it even means that the mother has a role to play, the husband has a role to play, the community has a role to play.
We health workers
also have a role.
Yes.
So how can we solve this in during pregnancy?
Okay, so let's talk about what can cause these things.
Okay.
As I said, we were talking about childhood abuse. When one is abused during childhood, this person grows up not to have even love, to think about even sharing with somebody. And so this individual is always alone. And so when going through pregnancy stress and things, they are not open to tell people because they don't trust. And then we also have socioeconomical challenge. Now pregnancy, you have to be changing when you go for antenatal care. You have to do your hair. Some people
I had a lady telling me she couldn't even get money to buy food. She's pregnant, so you can imagine.
So you see, this individual is pregnancy stress plus that. And some is like the one who even impregnated her is not willing to accept, or it was unwanted pregnancy. I didn't plan. You understand? It can also lead to that. And then we also have our environment, like a teen who is pregnant, born in a school. Everybody is on you. When you are going and coming, even at church, people will be talking about it. And so it even also puts you to stress and then depression. We also have something we call personality type. We have some individuals, they are very quarrelsome. The next minute they are fighting. They are fine with you the next minute. So you see, when pregnancy stress and its own inconvenience comes in, then the individual becomes worse. And so people run away from you. What happens? You will be stressed. Even your husband will be fed up with you. And so it can also lead to that. And we were also talking about individual physical condition. Maybe there is other conditions already. Pregnancy has compounded it. People with back pain and things, when they are pregnant, it gets worse. We also have other physical conditions like hypertension and things. So when pregnant, it gets worse. Some also have depression or anxiety due to past experiences. Maybe it was cesarean section, miscarriage, or still baby. So this time, what will happen? Am I going to get my baby?
It's very true.
Will it be cesarean
section? A lot of anxiety.
And then, or what will happen? Will it be eclampsia? Or you see all these things, and then sometimes the expenses like those with bad socioeconomical status. Hey, can I pay? Maybe the first one it was some NGO who came to pay on her behalf. Now she's pregnant again.
Now we are going to talk about the signs and symptoms. So if someone is pregnant, what are some of the things that you will see that will let you know that this person is it's probable that I think you should be able to diagnose yourself first, right? So what will make me know that I'm having it, or I'm having a mental health challenge, or what will my partner see that my wife needs help?
Okay, as I said, the individual is not able to sleep. Pregnancy comes with its own discomfort, but with this, it goes and comes. Once a while, when you visit your midwife, they are able to teach you the things to do so that you'll be able to sleep, the position, and then even the time to eat and other things. But you see, with this, no matter what you do, the individual is not able to sleep consistent for 2 weeks or more, and then always complains of headache. When you check the BP especially, it's always high. Even the BP medications and other things that you have given, still high. And then when they come, most of the time you see that we nurses, we are situated at the back, watch our clients walking. You even see their facial expressions, the way they walk. If you know them, you see that they have changed totally. Not the pregnancy way of walking, but you see that no, this person is not feeling
something is just not going on.
Yeah, you could see that there's something wrong. And then when they come to, sometimes some are timid to give information. It probably maybe the way other people are around. So we are also saying that if it can be a cubicle, one-on-one, so that informations can be given out. And also you see that they miss appointment dates.
Okay, so this is so revealing. So even missing appointment days.
Yes. I couldn't get a new dress. My husband didn't give me money.
We never think about that a pregnant woman cannot come for antenatal because of a new dress. But I think it's possible.
No,
because
I do
makeups,
new hair, every appointment date, you see, and then they are in groups. So let's say that I come with group A, and then every time the people that comes of class, and I'm part of them, I want to, people with low self-esteem want to, when they come, and then the next time they are not getting dressed, why would I come? They'll be looking at me and say, today my dressing is not good, and so they will not come, they will miss appointment. Some too wouldn't even want to come for antenatal. They will come the first time until 6 months before they come again. Why? You want pregnancy or you want a baby. So why won't you come and then know the welfare of the baby if everything is okay? But they want to stay away. Aside what people are saying that because of the COVID, no. You see, naturally, the person doesn't want to come at all.
Then she doesn't care about the pregnancy.
Yes, sometimes it's not them. Something is going on. There is marital issue. There is financial issue. Something is going that they themselves, they don't even know. They can't even express it, so they will not come at all. Some two will come and they will say, Antoinette, and Antoinette, into me now. And say, they may not cry. Into me, they are not. And say, papa.
Let me make a point here. So I think with what she's saying, it's so obvious that we, the midwives, who are also watching and listening, if you can share it, do share. We should be able to see some of these things from our clients, and we shouldn't always blame them, because that is what we do. Madam, antenatal, and then when you say pregnant, here, like we say a lot of things to them. I think I'm a victim myself, because sometimes, like, you just don't understand, but it doesn't even occur to us that could there be a mental health issue too. So I think what you are saying is so revealing, and we the midwives, all the things that she's saying now, we should watch, and then we can refer them to the community psychiatric unit. Or
yes, even if there's a psychologist around or there's a mental health unit, you can refer them.
But our system,
not necessarily that this patient is mentally ill. No.
But she needs some counseling.
Yes, she needs some, because it's not all the time that we give medication. Medication is the last
resource
that we do. We start with counseling. You see that when you go to the hospital, they take your age, your marital status, and other things, even your occupation. So these are all information that are important, even midwives. So with this, we'll be able to tell us that maybe I'm a nurse, and then where I am, I'm pregnant, and my boss said, Chinch, I have to come to work no matter what. And so because of that, I have to, it's not comfortable for me.
Yes, you become very uncomfortable.
So all the time I come with complaining, I'm tired, and I also don't want to lose my pregnancy. So it's become stressful, it will lead to not being able to sleep. So when our clients comes, we have to, as they walk in, let's observe them each and every day. And then when we are talking to them, some you could see that they are sharing tears, but they are smiling with you. Or when you talk and say, You see, all these things are information that is telling us that there is something behind the home. And then sometimes we ask them to buy medications or to do certain labs. And you see that this woman woman is not willing. It's like you like the pregnancy, but you don't want to do the lab. Why? You understand?
I feel that
yes.
Especially mothers, sometimes, I don't know. Like, you have raised a good point. Because sometimes the person has gestational diabetes. She's supposed to be checking her sugar regularly. She has high BP. She's supposed to take her medication. And you explain, and you think this woman should understand because of all the complications she will get. And she's still doing it. And you, the midwife, honest, you are frustrated. And she
doesn't see anything wrong. Yes.
So
sometimes it's not that she doesn't know, but where are the means? Even if she knows it, when she goes home, who is she going to tell? That is what the midwife told me. So what do I do? Or even because of the depression or anxiety, she is not able to ask you more questions. That what will be if I don't do this? Or if I do this, what will happen? Or I'm not even able to buy food for myself. So what you are telling me, I can't do it. Is there any alternative? Because the person is despair or anxious, you're not able to even ask all these things. And so most at times what we do is more observation. If you know your client well, you will know that Auntie Man said, there was some Casacra and Yamife. I said, when you cry, so in shadow and you will be. Then
so that's why they are doing the one-on-one. You must have that same midwife till delivery. That's why they are doing that.
I think it's very important so that you know the person very well. When there is a change, you will be able to know that no, this person is not. And then when they also come to, most of the times we also give them educations. I know my facility like this, we go there to educate them on what to expect during pregnancy and after, and then so they should also help us when we come. They shouldn't frown. It's because of them.
The patients of the midwife.
Sometimes they want to ask where they were casado. Let's like talking because we want to serve and give our best. When there is no cases, we will be free. And so it's really needed. But what makes me passionate when it comes to mental health or illness is the unborn baby. You see, when the mother is affected, it affects the fetus, the developmental stages. If a woman is depressed and is eating too much, other things, it affects. We have diabetes affecting babies also, and then their developmental also is affected, delay and other things. And so that is what this depression and anxiety can do.
That's really revealing. That's really revealing. I hope we are learning a lot. We are learning a lot from you. So if somebody is pregnant and she's having all these things, what can she do? Like, because I have cases where it is not identified by another person, by themselves. They themselves, they know that this is my situation. So what can they do?
Okay. When they come, because they say mental health unit, so they think that, oh my God, no. We have to tell them that even if you are not able to sleep, we do. Because we try to identify what is the cause. And then we help you to find a way of coping with it. Because when the stress is there, or if you are not able to eat or you eat too much, or where your BP is always high, even with medications and other things, you can tell them to go and see the mental health nurse so that we know why your BP is.
So the mother herself, what step should she take?
Yes, as I said, sometimes
should she just
come
walk
to the
in?
hospital. Yes, they should walk in. Now they have the wellness clinics where you can walk into any facility and check your BP. During the check, you see sometimes the BP is high, and then they might like maybe
try to find out.
Yes, and so you can tell because into now when I say the cry and they will refer you to appropriate service personnel if it is the counselor, psychologist, or mental health. Because my place, I see they mostly refer people to us, and then by the time you realize just something small, as I said, dress, or even financial difficulties that is causing and so. And then we should also check parents or pregnant women who always complains of pain. Sometimes it's not because that it's the pregnancy that is causing, but it's as a result of this depression. You know, they always, because there is stress hormones, they are always weak, and they have all the joint pain, the headache. And so the para that you tell them to eat, to take, is not enough for them. They want to take higher level of painkiller. We should also observe. And then some people, when you give them the folic acid and those, they see as small. Now when they will scatter and then you see, not because it is not good, but sometimes they have low self-esteem. They think that when I take this medication home, until you come hospital, go in the man. Because I'm not in this time. In this kind of mama say so we should also explain to them that this and this. But when we explain and see that still the person don't understand, we can refer them. So, connect with maintenance, you can so no one go walk a crack. Now you can say, one and baby, and now pain in the coffin, and now maybe a BP was strong. With that one alone, they will come.
I think we've said a lot. At a point, I was asking whether it's information or mental health. And from my place, like the kind of work I do, I have also realized that information gap is a huge problem when it comes to maternal health, mental health, because let's say I'm pregnant, I don't know there's anything called gestational diabetes. I don't know anything called gestational hypertension. I don't know anything called placental abruptio. I don't know anything. And all of a sudden it happens. Yeah, so I think I would add up that our mothers should, when you are pregnant, you should read more about the condition. You can join a class like we have. Yes, and you can, and so, because if you know, if I know that I can have this complication or I can have this risk, then I can take steps to prepare for it, so that I don't find myself having preeclampsia and I'm too shocked. Like, you know, if I have never heard about preeclampsia and all of a sudden I'm being told my BP is 200, 110, I would think that it is somebody who is doing it. Because I haven't heard about it before. Why is everybody, all the people in my area, I know they walk around with pregnancy. And all of a sudden,
in my family, nobody.
So I think that we should prepare mentally, as you said, and then we should also read and also join pregnancy class, ask for help and all that, and then we would get the kind of help that we need. Would you like to add something to the pregnancy session so that we move on?
Yes, as you said, there are a lot of information around, but you see, is that particular information good for you at that moment? Sometimes when we go to the hospital or we join the pregnancy schools and other things, I don't know whether it's language barrier. Now there is voice notes or something. You can just, whatever you want to express, you can speak it out and then send. And so when we go, let's talk, let's say the good information, whatever that is wrong with us. It is not about a midwife, it is about me who is pregnant and I want good health. So let's express ourselves.
We should be able to speak.
Yes, and then when we are told of any information, we should ask more. If it is true, fine, why not? Are we there for why?
It's very true, because I have seen a woman who went to the tent of like a little for her to lose her life. Because when she came to the ward, I don't know, but I feel that she had some preconception about nurses. And so with the little thing that the midwife was saying, even in her favor, she picked the crowd, and she was in the bed bleeding, and this nurse was alone, so she won't call him. It's serious. You understand? So as you said, we should be open, and we shouldn't think that if there's even a problem, you, the patient, will suffer first.
Yes.
So, and it could have been too late, if not because another nurse walked in and she asked the other nurse. That means she would have been, just because she didn't want to speak to the other nurse.
Your health is important.
Very important.
Your health.
And I've seen a woman who refused to speak. It was the husband who followed her to the antenatal one day and said, my wife is not eating. By any time she comes, the midwife has a BBI, so the midwife will, if you don't tell her your problem, how will she know? As in safety, if you're having your headache or backache or bleeding, how would I know? So communication, as you said,
is important. And then the right information. We just don't go anywhere and listen to what somebody says and take it that, oh, okay, if I do this. No, individuality. And so the information should be at the right place. If it is a midwife, ask all that you need. Don't just go to a hospital, you see anybody at the entrance or in the hospital and say, Madam, you
should be sure.
You should be sure. And then you'll be able to get the right sort of information.
We are talking about mental health during pregnancy, and it's sponsored by Sally's Pregnancy Class and then Sally's Test for Expectant Moms. You can also come on board as a sponsor. Okay, so we were talking about during pregnancy. During labor, is there anything that can be triggered or that can cause mental health, or is there anything we need to know about during labor?
Yes, you see, labor is individual, and then also the way we all express pain is not the same. And so we are expecting the mothers to know that there is pain, so that no matter what, you psychic yourself. And then there is no need to be so worried, because most of the times we hear false information outside, as I said, then we carry it to the labor room. Like, oh, this person went and lost the baby, or this. It might not happen to you. Because we pray, what do I say? We perceive the fear before we enter. And so when it happens that way, already your people will go up. And then after that, the labor pain, yes, already anxious, labor pains comes in, and then after delivery, you see that the signs and symptoms of depression that was there, and that wasn't so much obvious, is now so obvious that we can't even do anything than to at least.
So from what you are saying, it means that even people carry so much anxiety into the labor ward, and sometimes the pain, even if the pain is a little, or like, we have been told so many bad things about them, and so that can even lead to a mental health issue during that time.
It's true, because with pain is there. You can't do it. Somebody might experience 2 hours, an hour, 30 minutes, 3 hours, 6 hours, but it's like you are expecting something. So what do? You do all your possible best. As I said, there's a challenge, but whatever that you do, so that you'll be able to go through the challenge successfully. That makes you a mentally healthy person.
So with the pain issue, I think there are other things that we the midwives can also do to you were talking about something like pregnancy school.
Yes,
you were talking about pregnancy school, so that you prepare your mind towards that.
Respect.
Yes, and I think that pain management options.
Yes.
When it comes to maternal health, those who are in the Western world, they are blessed, they have a lot, but here it is not so common. Like sometimes, but even with that, having a support person by you, so the husband, I think, would really their involvement in the labor, and even at that time, there's a little gap when it comes to our settings, because our delivery rooms have 2 or 3 mothers, and then husbands cannot be there, or the support person cannot be there because they don't want to expose the other clients. So I think these are things that we can. I think this mental health issue is bringing up because we want some kind of privacy. We want comfort from our partners. We want to feel respected and supported during that birth time. And you are telling us that if those things are not there, can even trigger.
It can. What we are saying is that although our system now, that is all we have. So what do we do as a mentally healthy person? Let's create something. What am I saying? The husband can be around the hospital with the wife knowing that my husband is there. Even if he is not with me, he is around.
Support
and if anything, they can call him for me. But you see, at times, the husband will be away due to work or something. And that is not the best. And with our part of the way things are going, unlike those days, all your aunties will come around, they are sitting down there, once a while they will come and check on you. Now it's not like that. So the support system is really important. The husband, if not the husband, at least a parent or an auntie can be around. The fact that you know that there's somebody there, you are rest assured that if anything, you see, some mothers also think that after delivery they might change my baby. So even as they are there, their mind they have the anxiety alone is so yeah. So if somebody is there, there's rest assured that we're checking on them. If they are doing something, the person will be there to support. That one alone is even a support. And then expect that labor there is pain, depending on how your own will be. But I will go through. That one alone even reduces your stress. Yes, I trust. But don't say that until I answer like this, until I go like this. Perceive fear. No, it doesn't help.
So I want you to throw light on finances, because we've had issues where the woman was brought, and then at the time of labor, because of something, she couldn't deliver. They need money for operation. They need money to buy certain medication. Sometimes the facility doesn't have everything, and so they give their prescription to the man. The man doesn't have any money. They have to send the wife from one referral hospital. Maybe she came to the polyclinic. She has to come to them in general. And if your hospital ambulance is not there, and you need to call an external ambulance, you have to pay. And so, and the people are not prepared. How do you think that it plays a role in that? And how should the mothers prepare financially?
Sure, it's really important. As I was saying, that unemployment. You see, once you have planned to give birth, try to do something. You know, pregnancy is not a disease, but rather unfortunately some people have their own in other way. But you must try to do something and then save towards it. You might not have all, but the little that you have, somebody might also contribute. And so if you don't do anything, say that there is COVID, so when you go out there, you have it, and so you will not go. How do you eat? How do you get money during that time? And then we are also saying that let's face our children. When we talk about it, it's like, Auntie Nancy, we're serious. No. You see, we need money also. If you have, somebody can even add up. When you don't have at all, what happens? So we are also saying that let's try as mothers to support. Let's get something in our purse. At least something will be hiding there.
I said something about women saving, and somebody came to my inbox, and how can you tell pregnant women to save? And I don't know what kind of perception the person is thinking, but we are doing things we are saying things that will help our mothers, because you don't want to be stranded when you are in labor.
And then at that particular time too, maybe I might not have the money. You understand? So if you were to save something, the hospital would have taken it and then expecting that in 2 or 3 days, other people will come into. But when you sit down and hope that somebody will come to your aid, where is the person coming from? We need to refer you, don't have money. And then this is where when you refer them, they just pass somewhere else without even going to the hospital. So mothers, we are pleading. It is not easy. Even if it is not easy, we have a way. That is why we are saying that try to make a small way, so that you can save something, the little that you have. In terms of this, you will be able to save yourself from all this stress. So the support is really important. Your husband might not be there, your mother might not be there, but at least the family that you are in, how do you relate to them? As we said, the quarrelsome type. You have quarrel with everybody, so who will come? You understand? Or the church that we are. Let's try to find a healthy support, even not within our family, outside our family, healthy one. I didn't say the one that will say let's go and drink. So that in terms of need, you can call on somebody. Support is really important in everything that we do. Yes.
Thank you. Okay, so we are wrapping up. Let's talk about postpartum. The person has given birth. She has given birth, and she doesn't want to see the baby. She doesn't want to hold the baby. She's just crying. I've seen one. She doesn't even understand it, but she just feels some serious sadness, like great sadness within. And there are some that at the hospital we see they don't want to touch the babies. They said, and the nurses have stolen their babies. This is not their babies. A whole lot of issues. So what causes that too? Just as a baby.
You see that when the sadness is not managed well from pregnancy, labor pain, then it now becomes so obvious. because it comes with its own stress. And then you see that the individual is so down that at that moment there is even hallucinations. He sees the baby to be the cause of all that she is going through. Also, like, especially mothers with twins and so, after delivery, not even at the hospital, when they go home, sometimes 2 weeks, a week, 2 weeks, 1 month after, when there is no support, the woman is not staying with the husband. So she alone have to wake up. And you know, children, gone are the days, people will come, they will sleep, they will pound for food, I've been crying for you, and then you have enough food and rest. But now it's not like that. So the mother one is not having enough rest. Through all the labor pain, there is no money to even take good care of herself. Even to go out and buy things, who is taking care of the baby? And so the tiredness now becomes more, the stress becomes more, then it triggers. So you see that now the woman is having psychosis.
So what's the name?
Psychosis or postpartum psychosis, after delivery psychosis. So it has gotten to a stage where there is psychosis. You see the baby as even the problem. If not you, I wouldn't have gone through this. Some even go to the extent of killing the baby. They want to kill themselves. So it is when it's not manageable. And some, not that they have it, but previously they were having mental condition. But when they got pregnant, they didn't come for assessment again. And so after delivery, it can also occur, as I said, the labor pain, and then after delivery, children, some will not even sleep at all for you to sleep. As we said, sleep is also important. Yeah, it's also trigger. And then some too, we don't know what happened. As I said, it's all about stress and stress and stress.
So I want you to...
You want a baby girl. Now it's a boy.
Today, just today, I had a mother who called me that she has 3 girls and she wants a boy. You know, those ones, I just encourage them to pray. But as you said, it can lead to a form of anxiety. Because if she goes to give birth again and it's a girl,
some will say he doesn't even want the baby at all. Or maybe as you bring the child home. Now, then he says a girl.
So all those comments are unfriendly. Like we shouldn't say that too.
Oh, look at the labor pain. Meanwhile, the person even couldn't get money to foot her bills. I brought the baby home and you are saying, oh, nipa na. A lot of mental torture has gone during the labor. So we need a lot of sleep. And then if you're a single mother, as I said, you don't have anybody to support you, or even per the nature of your work. When the baby is sleeping, sleep. Don't say that you want to clean, you want to do this. By the time you finish, the baby might be awake. How do you sleep? And the baby doesn't know that you're under stress. You only want to eat and that's all. So, we'll plead that when the baby is sleeping, sleep. When the baby wakes up, you feel small, you try to put things in order. And also, when you don't have enough money, we are not saying that try to dress in a certain way. Try to put on white, that means that you have given birth. No, we have to live in moderation. Whatever that you have, we thank God that you have given birth. Whatever that you have, it's okay. Somebody wants a child, he doesn't have. You have gotten, and you want, because of dress, you want to die, or you want to die. And mental illness is real. Most of the times we think that it is spiritual. Good, there might be spiritual causes, but we have realized these days that it's as a result of our day-to-day activity, not being able to rest well. That brings my mind to phone. Before we sleep, we have to read all the messages. And so you go back to sleep with sad, if the messages were bad ones. You see that you go with sad mood or even anxious, and then you have all the nightmares. You will not be able to sleep well. We wake up with reading other comments, and so you have the sleep pattern is even distorted. It's not enough, and so it also affects the mother also. So let's also put our phone aside. Televisions, let's reduce. Let's try to reduce other things that it takes away our sleep, it takes away our rest, it even affects our human being. Don't say that, oh, really energy. It might affect you because there's a lot of stress in the system.
And I think I will also adapt that there are lots of women, when they finish giving birth, they want to prove to the whole world that they are strong enough. I've finished giving birth, but I can do everything. And so they don't allow people to help them, they don't allow people to assist them. they want to show, what would you tell them?
I would say that, you see, who are you trying to please? Me? No, you can't please me. You want to tell me that you are strong. But the next moment when you are not well, who will take care of your baby? So if there is help, let's try and then take that help. And then some also, they want to make sure that they remain like the shape they were before they got pregnant. And so they will not eat well. They want to take a lot of medications to slim. You see, it's hormonal. Allow natural cause to take its own place. But if you want to force yourself to slim, to have that flat tummy and thing, you are putting a lot of pressure on you. You are not eating well. Your nutritional value will also reduce. And it can also affect your mental health.
Well understood, well understood. So thank you so much. I wanted to ask a question. I know about depression, psychosis. Are there different types, like cerebral psychosis, baby blues? What's the difference like? Take me through how it graduates from one to the other.
You see, when we talk about the baby blues, as I said, when a baby is born, when there is mixed feelings, there is joy, there is pain. The pain that the mother went through is there, but the joy of seeing the baby comes in. And then when the baby comes, the baby is not able to sleep well. So all these things are stress that the mothers go through. So she wouldn't be able to sleep well. But at a point in time, she recovers. It's of a short duration. The mother recovers and then things goes on. But where the baby continues to cry, you are not getting any support, you are not getting enough rest, there is marital issue. Now it's like the situation gets worse each and every day. Then it leads to the depression we are talking about. And then that is the postpartum. Then some people can have major depression, the bipolar, and other types of mental conditions. So,
Understood.
So baby blues is normal.
Okay.
And then when it is not managed well,
then
it leads to the postpartum.
Okay. So with that one too, sometimes it happens at the hospital, so treatment starts there. So if the person goes home and the person realizes it, what should the person do?
With the baby blues like this, we don't give medications. We mostly encourage the relatives to give her more support, to help her take the baby so that the mother can have enough rest. Yes, but when you bypass and then it is now depression, the mother needs to be on medication for a while. Sometimes it's so severe that we have to take the baby from the mother. If not, the mother can even kill the baby. This mother needs attention. You can go to any facility, being polyclinic, hospital, CHIP compound, and then they will refer to a needed facility for attention. And when there is a need for admission, we will do, or if there is a need for detention for few days, we also do. And then also you can walk to any private hospital too. They also refer to where needed. Don't say that where you are staying, there is nobody there, so you want to go to the prayer camp. Prayer is also important. But after the prayers, let's also seek other treatment and to help. But when it is depression, postpartum psychosis as in suicidal, is purely admission.
Okay. Thank you so much. This has been very, very insightful. Okay, so if my mothers want to talk to you, or somebody's watching and the person who wants to speak to you, we can ask the session. She works at the Pam Polyclinic. She's Auntie Agnes. If you want anything on mental health issues, you can contact us through our inbox messages and we will connect you so that you get the right support. Right now, I think I'm working with a gynae, so if you want to see a gynae, if you want to see a mental health, somebody in the mental health, or somebody, you need a nutritionist, you can still come to our Midwife study and we would link you up to those services because everything is interlinked and a midwife cannot work alone. So we have all these people coming in. If you need them, let us know. We will link you up. Thank you so much for watching. Your last words.
Thank you very much, viewers. What we are saying is that if you are experiencing any psychological issue that doesn't mean that you are weak or you are not smart or like you are not of the current modernization issues. No, it is sickness or it is a challenge that you need help. Seek help. Go to any facility of your choice and then you'll be attended to.
Thank you everyone for watching. Also remember that we have a pregnancy class that will take you through the period of pregnancy, labor and delivery. Even after you have given birth, there's still more information for you. Our book is also available, hard copy and soft copy. So for the soft copies, Amazon and Okada bookshop, and the name there is Sally's Tips for Expectant Moms. So you can Google it and then you find it, Sally's Tips for Expectant Moms.